I would define them as angels of mercy because when times get hard, they are there to not only help the patient, they are also there to help the family who is going through the grief and loss of what is going on in their lives. And that to me is compassion, and that is one of the biggest features of a nurse. Much better. There is more equipment, there is more chemical things that we can do and use for our patients. There is so much more accessible things for us to use and easier for the nurse too, with all the monitors and that we can look at and see what their vitals are without wasting time is a great improvement since I was a nurse. Yes, they do. They have more respect now because I think they've learned that being in a hospital and the environment they're in, they have to have respect for the patient, for the family, for the doctors, and anyone else they work with. Yes, I do. In ICU, when a patient is critical, sometimes there are only 1 or 2 nurses, and I think 4 to 1 would be a better number of nurses to be at the side of a patient who is critical in an ICU. Well, the nursing shortage, first of all, I think this 12 hours a day, nurses get burnt out, and that's when they decide to change professions and get other jobs. But the other thing that is good in one way, because if you have children, you can work nights or work evenings and still be there for your family. But the other part is basically when you don't have enough nurses, you get burnt out on what you're doing. So I think if we had enough nurses to treat the patients the way they need to be treated and heal them, then I think more nurses would enter the profession. They have been exceptional for the simple reason, being I was a nurse, they respected me as a nurse and an active registered nurse. They have the highest respect that a person my age can still do the things that I do and be able to help Pop the whole 10 months that he's been ill with leukemia. And that has made them realize, you know what, this is all good, and but for the grace of God, there goes someone in my family. No, I haven't had bad experience with nurses. I've had more bad experience with doctors. Nurses are totally fantastic. Angels of mercy is what I call them. I just hope and pray that every nurse that goes into the nursing profession feels the same way that I do, and look at each patient and say, if that was my mother, my father, my sister, my brother, what would I do? How would I treat them? And believe me, you could become the best nurse ever.